In addition to hand instruments, power equipment is necessary to perform dentistry efficiently. It's important to understand how these tools work and what should be done to properly maintain them. In this video, we will discuss the power equipment used in veterinary dentistry and things we need to be aware of when using these instruments. We have Tammy Smith with us, who's a veterinary technician specialist in dentistry, and she's going to discuss the different power equipment used in veterinary dentistry. So Tammy, what kind of unit do we have here?
So the unit that we have here is a complete dentistry system and contains all the components on the powered side that we need. There are large numbers of manufacturers of this type of equipment, as well as some that make the pieces in standalone versions. And we'll mention those as we move along with things. So I wanted to start by talking about ultrasonic scalers. They are a very common piece of equipment in veterinary hospitals. I would hazard to say almost everyone has one of some sort or another. They do come in various configurations. You can have a standalone scaler unit by itself. They can be integrated into the dental unit like we have here. This particular one is a piezo scaler. So the ultrasonic scalers all vibrate. That's how they dislodge the tartar from the teeth. Due to the fact that they vibrate, they do generate some heat. So we want to keep that in mind. If we overheat the tooth, we can certainly damage it beyond repair. So you want to make sure to keep that in mind. What I like about this particular unit is that it generates less heat than most of the units on the market. This one also has a cruise control feature which regulates the amount of pressure that I, as the dental technician, apply to the tooth. So the more pressure that I apply, the less vibration that occurs in the handpiece to help protect the patient's tooth. These can be used with a variety of different tips, and we want to talk about these a little bit. In general, the tips come in different shapes. There are the wider type blades, are also called a beaver tip. There are narrower ones or more universal ones that could be used for any patient. And then there are very, very narrow ones that deliver a little bit more water towards the end of the tip that help keep it cooler, and these can be used in shallow pockets. This is a great invention to have something that we can use a little bit below the gum line. We know the tartar that's on the crown of the tooth is very easy to remove. A lot of times we can do it in the exam room on a conscious patient with our fingernail. But once it gets off the enamel surface of the tooth, where it's down on the cementum, where it's rougher and it's not so shiny and smooth, it can be really difficult to dislodge that. So having a tool that we can put in some of those shallow areas is a huge help to us.
An ultrasonic scaler is used to clean the crown surface of the tooth, but actually more importantly to clean under the gum surface or the subgingival surface of the tooth. The way the ultrasonic scaler works is that the scaler is going to vibrate, and in addition to that there's water that comes from the scaler, and the combination of the vibration with the water is going to help remove plaque and calculus.
These are the different tips for this particular scaler. This is a beaver tail tip. We can see that it's wider and flatter, similar to a beaver tail. This would be used for large chunks of tartar, or it's labeled as for voluminous tartar removal. This tip here is a universal tip. So we can see it's a lot narrower than that beaver tail tip, and this would be more appropriate to use in a cat or smaller patient, as well as for those patients that don't have quite as much tartar. The one on the end here is the one that's designed for use a little bit below the gum line. It's rated for 1 to 3 millimeter pockets, so we can insert this a little bit below the gingiva. This is ideal for those areas where the tartar is down on the cementum of the tooth. We know that when the tartar is on the crown, a lot of times in the exam room, we can pop it off with our fingernail. Once it's down below the gum line and onto the cementum of the tooth, it's a lot harder to remove. So this makes us a lot more efficient in our dentistry cleanings to have something that we can use in those shallow pocket areas. Another thing to keep in mind with these tips is they don't last forever. So we're taking something metal and putting up against a very hard surface in the body, so they do wear down over time. When we purchase them, they typically come with a tip card, something like this, which gives us an idea of how long they last. So when we take our tip, we can lay it up next to this picture, and it will show us if we're into the green area, it's still good to be used. If we're in the yellow area, It's getting some wear. And once we're down in the red, this instrument is not working as efficiently as it needs to. The back of this card shows a number of the different tip styles, so all we would need to do is find the one that corresponds with the tip we're testing and lay it up next to that, and we can see what zone we're in with our tips.
Ultrasonic scalar tips are going to wear down with use, and once they get to a certain point, they're no longer functional and no longer efficient. So you should have a measuring device, a card that has the proper length of the ultrasonic scalar tip on it, and you should check that at least once a week and replace those tips when it's indicated by the manufacturer.
So next I'd like to talk about the polisher. We want to use this instrument after we finish our scaling and our hand scaling as well to smooth out all the rough surfaces that we've created on our teeth. We should make sure to hit those areas below the gum line as well as the crown above so that we cover the entire surface of the teeth that we used our instruments on. There is a Profi angle that goes onto this instrument. So this is a disposable Profi angle. These are really nice to use because we can use one per patient, so we're not risking any cross-contamination. There are metal versions of this that are available, and they do have a tendency to grab hair and maybe yank out a big chunk. With those type, there's a screw here, and you just replace the rubber cup in between each patient. If you have one of these, you definitely want to make sure to unscrew that little screw and clean underneath it. You'll be amazed at what you find in there. This particular Profi angle is ribbed on the inside of the cup and the outside of the cup, and this makes it really efficient. So as we're using the inside to polish one tooth, we can be using the outside to polish the tooth next to it. So it's super for efficiency. There are numerous versions of these disposable ones. Some oscillate, some spin, all sorts of different options when we purchase these. So these little cups contain our Profi paste, and this is kind of the sandpaper inside of our Profi angle that we use to smooth out the rough areas on the teeth. These are also nice as individual little cups, so we're not getting any cross-contamination between our patients. So you would use 1 cup per patient, and you want to use a fine or medium grit on your Profi paste. Okay, next we're going to talk about our high-speed handpiece. This is typically used by the veterinarian for oral surgery, but as technicians we do need to know how to maintain it and essentially what it's used for. This is used with multiple types of burrs for cutting. So in our burr block here, we have 3 different types of burrs that reflect some of the common types used, and there are numerous available on the market. This is a round burr. Typically, the veterinarian would use this style of burr for removing the bone surrounding the tooth or the alveolar bone. This burr is what's called a crosscut burr, and typically this is used for sectioning the tooth, so when the veterinarian wants to take a 3-rooted tooth and make it 3 single-rooted sections. These are diamond burrs, and these are typically used to smooth out the rough edges and sharp spikes that are created during the oral surgery to extract a tooth. One thing to keep in mind with our burrs, they are meant to be single use. So just like any other cutting instrument, these get dull, and when they get dull, they start to increase the pressure on the machine. So with our high-speed handpieces, we do want to keep in mind that they are a little bit technique sensitive. So if our burr is dull or the veterinarian applies a lot of pressure, it can damage the turbine that is inside this unit.
Burrs that go in your high-speed handpiece are meant for single use. It's really important to use them on one patient and then discard them. If we try to use the burrs more than they're meant to be used, the burr gets dull, and it causes us to work harder and put more pressure on the tooth, which can result in more damage to the tooth and to the patient. In addition to that, burrs are relatively inexpensive compared to the turbine in your high-speed handpiece. The turbine in your high-speed handpiece is what is utilized to turn the burr around, and if the burr is dull, the turbine has to work harder, and that can lead to destruction of the turbine, which is a very expensive piece to replace.
So the last tool that we have on our dental delivery system here is an air-water syringe, and this is one feature that you do not get if you're using standalone units. So this we have 2 buttons on the top of it. One will deliver air, the other will deliver water, and we can press both together to have a combination. So this is great for rinsing out all that tartar and calculus, rinsing the Profi paste off after we're done polishing.
Well, Tammy, now that we've talked about each one of these instruments, is there anything we need to know about the maintenance of them?
Well, there's always maintenance for everything that we have. This particular unit is an air-driven unit that has a compressor to generate our air to drive our instruments. The compressor in this unit is oil-free, which is a super nice feature. Those compressors that have oil in them require oil changing and things of that nature. I would certainly recommend that whatever instrument you have, refer back to the manufacturer's instructions and make sure to hit all the maintenance points that are required for the instrument that you have in your practice. One thing I would like to mention is the high-speed handpieces, and these do require some maintenance beyond just the general. On the base of this instrument, there are 2 holes. On this particular unit, we actually use a conditioning spray, a handpiece conditioning spray, and we put the tube on this down into this hole and spray it through. Other handpieces may require a couple drops of oil in this same hole. So we also want to use the cleaner conditioner spray on our low-speed handpiece as well in the same opening on the bottom of the handpiece. So another nice feature of the complete dental delivery systems is that we have storage for our water. This particular unit has 2 water bottles, so if we run out of water in one bottle during the procedure, we can flip this toggle switch to the other side and easily switch to the other water bottle. One thing we do want to mention with these is that we don't want to place chlorhexidine in the water in these solutions. It has a tendency to really deposit inside all the tubing in our unit and can really clog things up. If that's something that you really feel you have to do, you really need to make sure to do extra maintenance on your system.
Some veterinarians prefer to add chlorhexidine into the water of their dental delivery system. The purpose of the chlorhexidine is to serve as an antiseptic when we're working in the oral cavity. Be sure to follow your manufacturer's instructions for the dilution ratio of the chlorhexidine, as well as any additional maintenance you're going to need to provide to your unit.
Well, Tammy, thank you for going over the power equipment with us today. As you can see, it's important to become familiar with this equipment in order to provide better dental care for your patients.